Hi, I'm Robert Spencer. Welcome to Moving Beyond. You know, here in Boise, Idaho, it's the middle of August now, and the summer is winding down, and it's about time I got busy and started producing some classes for the fall. In addition to that, it's time I got busy and had another one of these newsletters because there had not been one for this summer. So I'm glad to be here with you today. I'd like to start off this series by telling you the story of a woman who came to see me a while ago. I have her permission to tell you her story, and I'm going to alter some facts and words so her privacy is protected. But she is a retired school teacher from Northern California who moved here to Idaho after retirement, and she told me her history, which is really, you know, it's not one that you would like to share very much of in a certain way, but she talked about how living in California, she was rear-ended in automobile accidents 7 times and T-boned from the driver's side 2 more times. And this produced a lot of injuries, most of which she recovered from, but it has left her with a lot of pain in her right sacroiliac joint. And this has caused a lot of problems. She also was injured in her left shoulder due to this, which is a continuing difficulty. Before that even, she suffered from a lifetime of frequent headaches. She's also a breast cancer survivor. She had the surgery and chemotherapy for that, and the chemotherapy has apparently left her with a peripheral neuropathy. That means that she has a very hard time feeling what's going on and where her feet and her lower legs are. What really produced her call to me, however, was she started having numbness in her groin. And this was diagnosed with an interesting sounding word. It's called cauda equina, which is Latin, I believe, for horse's tail. And apparently where the nerves come out from the lower spine and come down into the pelvis and legs, it looks to some people kind of like a horse's tail. But when there's difficulty there and the numbness is caused by a compression of certain important nerve roots that come out of that area, it's often a surgical emergency because left untreated it can produce a permanent paralysis below the waist, and it can produce a difficulty or even loss of control or function of the bowel and bladder. Now, she couldn't have that surgery because of all of the complications that she's had through life, because the surgery then would have been dangerous to have and dangerous not to have, so she was kind of stuck. A friend of hers who's a client of mine suggested that she give me a call and maybe come from where her town is. She lives, by the way, several hour drive from here. It's not easy for her to come. And if you've ever had joint pain, your SI joint, sacroiliac joint, you know that riding in a car is not one of your favorite activities, probably. So she came and she told me her story. And I'm just, wow, that's a lot of stuff. And then at the end of her story, she says, "And you are my last hope." Now, the reason I want to tell you her story is not because I'm a great practitioner or anything like that, but it's going to be a chance to talk about how the Feldenkrais method is going to look at this problem a little bit differently. Because when she said, "You're my last hope," I was plunged immediately back into my old personal inadequacy and thinking, wow, she's had all of those smart people with expensive machines and hospitals to help her with this, and they couldn't get rid of it, and now she wants little old me to do this? How is that going to work? I can't do that. Fortunately, I have over 30 years experience in this work now, and it took me only about 1 minute to get over that. And it came in this form of a thought. Look at this like a Feldenkrais practitioner. You're not a doctor, you're not a therapist, you don't get interested in curing any specific conditions that she has. Help the woman to live a life in a way that is more comfortable. So one of the ways that we look at that, how is it that she has a life that is less comfortable? Well, you can approach this by looking at the qualities of her movement and the availability for action in her life. So it means that there are some directions in which she can move easily and other directions that maybe she can't move at all or with more difficulty. She has to overcome something in herself to go there. Now this pattern can be important when you've got a damaged area and a pain problem, because the arrangement of holding yourself as she does. For example, she stands almost exclusively with the majority of her weight on the left leg, seldom weighting the right leg, only to take a step on it. And this directs a habitual pattern of strain through her tissues, including into the very area where she has the most difficulty. So how can I help her with that? She is a human being who lives in this world, and she has to deal with the interactions with this world, including this dominant physical force of gravity, and how she manipulates the weight in a way that produces more or less strain in her tissues. Stay with the quality of movement, I think. Do what you do. Give her a Feldenkrais lesson. So I'm not going to detail how we went into the lesson. We worked for about an hour together. But I will tell you that another one of the things that distinguishes our work is we don't go to the place where the pain is usually at first. Most of the time we'll work far away from that. So I did that with her, gently moving, finding out where she can go. It's a series of nonverbal, sometimes verbal, but nonverbal questions about her organization, her ability to act, and do what she wants to do in the world. Now, I'll give you one particular example. She was lying on her back on my table, and I started to lift her right shoulder, and it lifted very easily. And it lifted easily. I could tell it was involved with an offsetting of her chest, that her weight shifted to lie more completely on her left ribs and left shoulder, and that made her right shoulder very easy to move. This is handy because she's right-handed. Now, when I try to lift her left shoulder, it won't go at all. I mean, I'd have to use a lot of force to do it, or she would have to do a lot of force. But I noticed that when the signal comes to raise the shoulder, her chest doesn't move at all. You can't lift the left shoulder if you're busy lying on it. So we didn't mess with the shoulder. We worked gently through her ribs, through the top part, through the collarbones of the shoulder, so that she could gradually sense, and it didn't take very long, a minute or so, oh, I can lie with my weight over on my right side, and then this side, my left side, becomes more available to move. So we did that. We worked largely from her head, from her shoulders, from her feet. And the result of it was that when she got up off the table, she could move with greater fluency in many different directions that usually are closed off to her, and it didn't cost her an increase in pain. In fact, she didn't feel pain at that moment. Now, she left, and I hadn't seen her in a couple of weeks. She had to go on a trip, and she wrote me an email that I would share with you. She reviews her history. She says, I've had increasingly worse SI joint pain for at least 10 years. After 5 minutes in a car or chair, it would start. After your session, I drove all the way home pain-free. Then I had to travel north and into Montana. Still no pain. I did overdo it, though, because we couldn't find a hotel and had to drive over 12 hours in one day. However, the big news was 6 days pain-free. Now, I wasn't that surprised that she had a result like this. This is a spectacular result, by the way. Not everybody gets there, although it's not as rare as some people would expect. But at the end of the session, there were some fundamental changes in her that were beyond whether she heard or not. And one of which was that she didn't seem to be so concerned with the pain. Because when it's been chronic, usually people's attention asks the question, does it still hurt or not? Does it hurt more? Does it hurt less? She had made a switch into what was possible for her. I can move over here like this. When she got up and she walked, she paid attention to how she transferred weight from one foot to the other, which was a task for her with her neuropathy, but she was able to get enough information to detect that. And then she spontaneously sat down and she started to move in different ways. She would move her pelvis. Now, these were her spontaneous explorations. I had some suggestions to help that along. But she was now interested in how do I make things in my life more possible, open more directions, do more things than I can do, and less focus on whether it hurt or not. So her entire demeanor changed. Her skin color looked so healthy. Her eyes had a sparkle to them, and it was in her voice as well. And I could just imagine that something in her had shifted from worrying about all of the problems she had to curiosity about what lay in her future in terms of possibilities for her life. So those are some ways in which we approach things differently with the Feldenkrais method. It's not medicine, it's not therapy, It's a way of learning, and it's a way of exploring together what can be, so that our relationship with the world around us can be better than it was before. We can do that at any age. So, it's good to talk with you all again. I'll use Mr. Spock's farewell and say, live long and prosper, and we'll see you next time.